Graham Morris.
Thank you very much, Mr Deputy Speaker, and I want to congratulate my honourable friend, the member for Pontypridd, on a most powerful and excellent speech there. And as a representative of a coalfield area myself in County Durham, I want to express solidarity with colleagues from Wales who've raised the issue of the unsafe coal tips and the need for funding. It's very poignant that the member for Pontypridd, my honourable friend, mentioned the terrible disaster at Aberfan. I know that touched many hearts throughout the nation, indeed that of our sovereign too. It was the most appalling tragedy, and we must never ever forget the debt of honour that the nation owes the coal miners and their families and communities. And I might say, it's not the focus of my speech, but I also want to express my disappointment about the failure of the Chancellor to address the historic injustice of the Mine Workers Pension Scheme. It isn't a case of as the member for Crewe and Nantwich, who's certainly no longer in his place, demanding more public money. This is the miners' own money, and it's a historic injustice that cuts those of us with mining connections to the quick, that it hasn't been addressed. But if you'll indulge me, Mr Deputy Speaker, I know the nature of this debate, the broadly themed debate, is people and businesses. I want to confine my remarks essentially to cancer, which affects people and is the most dreadful business. And I know the Treasury bench is populated by ministers with a background in science, innovation and workforce skills, and I hope they will relay my comments to their colleagues in the Department of Health. And I want to declare an interest because I'm Vice Chair of both the All-Party Group on Cancer and the All-Party Group on Radiotherapy. And access to cancer services is an issue that's touched me personally and about which I care passionately. About 50% of us are going to suffer and battle against cancer at some point in our lives. And a week ago I joined colleagues, honourable members from Gower, from Allen and Deeside, and Baron Fox of Leominster from the other place, together with representatives from national cancer charities, Cancer Survivors and the Cancer Workforce, to deliver a petition and a letter to number 10 Downing Street. The petition was signed by over 53,000 people, and the letter, sent on behalf of a coalition of national cancer charities, patient advocacy groups, 64 MPs of all parties, peers, all-party group chairs, called on the government to urgently invest in our vital cancer workforce ahead of the budget. I might say just a few months earlier, just before the recess, I presented another petition to Downing Street, set up by Catch Up With Cancer. That petition was signed by over 370,000 people. That campaign was launched in conjunction with Craig and Mandy Russell. I want to pay tribute to them, Mr Deputy Speaker. Tragically, they lost their daughter Kelly at the age of just 31 to bowel cancer, and her life expectancy was drastically cut short after her cancer treatment was stopped as a direct result of the COVID-19 response. Even before the pandemic, we had the worst 62-day cancer waiting times on record, and worrying variations in cancer services across the United Kingdom. So the pandemic's not just laid bare the terrible strain on the cancer workforce, and that's been happening for a number of years, but it's driven cancer services to a crisis point. Significant numbers of nurses are reportedly leaving or planning to leave our NHS following the pandemic. 1 in 4 NHS staff in England say they're more likely to leave their job than was the case 1 year ago. And in addition, long-standing unfilled vacancies and high staff absence and sickness levels continue to constrain cancer services. I'm a great admirer of Professor Patricia Price, who appeared before the Health Select Committee early this week and spoke of the biggest cancer crisis in living memory. To give credit where it's due, in the budget the emphasis on cancer diagnostic services was welcome. It matches the ambitions set out in the NHS long-term plan of diagnosing 75% of cancers at stage 1 or 2 by 2028, and projections are that 55,000 people each year will survive for 5 years or more following their earlier cancer diagnosis. However, and again, regrettably, I must take issue with points raised by members opposite with due respect. We need greater clarity on exactly how this money is to be spent. Unless the boost in cancer diagnosis is matched with an equal boost in treatment services and investment in the workforce to deliver those cancer services, they will continue to fall far short of the government's stated ambition. The future of the workforce is now the most significant threat facing the NHS today. We need urgent attention and investment in a workforce plan. Without highly skilled staff to work in the diagnostic centres, welcome though they are, we simply will not reap the benefits the investment in those diagnostic facilities will bring. We need investment in equipment needed for treatments like advanced precision radiotherapy, which I've benefited from, which plays a vital role in cancer care and continues to be the standout cancer treatment during the pandemic. Make no mistake, the cancer backlog's a huge issue. Without a fully funded plan to increase the number of skilled staff and train the future cancer workforce, more patients will see their treatments unnecessarily delayed. Investment in cancer treatment services and the cancer workforce needs to be expanded to match investment in cancer diagnosis. The two are two wings of the same bird. The two are hand in glove.
Both wings to fly.
Precisely. We must ensure that people living with cancer get the support they need and deserve, both now and in the future. The specifics are, Mr Deputy Speaker, according to Macmillan, we're currently 2,500 specialist cancer nurses short in England. Macmillan acknowledged Cancer's charity, urging the government to take action to create a nurse cancer training fund that could be set up with a modest investment of £124 million, and that would train 3,300 specialist cancer nurses. When we think about the huge sums that have been spent on the test, track and trace system, many billions, investment of a fraction of that sum in cancer treatment, modest as far as the budgets are concerned, would command majority support, not just on this side, but of the whole House and in the country. Thank you very much indeed.
Yeah.